Knock, knock, knock. I'm going to close current for patient privacy, and I'm going to do 20 seconds of hand hygiene. Hi, Mrs. Cap. My name is Joanna. I'm going to be your nurse for today, okay? Can you confirm your name and date of birth with me, please? Great. I'm just going to check that on your scan. Everything looks good. Thank you so much. Do you have any allergies? No? Okay, perfect. So I'm here to insert a Foley catheter as ordered by your doctor for your urinary retention. Have you ever had that put in before? You haven't? That's okay. I can just go through a procedure with you, okay? So I'm just going to start off by cleaning the genital area, and then I'm going to lubricate a catheter, and I'm going to insert that catheter through your urethra until it reaches your bladder, and then I'm going to inflate a balloon with some sterile water, okay? And then just to keep that in place. And I'm also going to put a stat lock on your thigh and then stabilize the catheter using that just so you can walk around a lot easier, okay? And the purpose of the Foley catheter is to remove all the urine from your bladder, and it's going to be collected in a collection bag, okay? And it should be a painless procedure, but you might find it a little bit uncomfortable while I'm inserting the catheter, okay? And we will need a little bit of a urine sample just to send to the lab. Okay, are you currently experiencing any type of pain? No? Okay, great. Any questions for me before I start? No? Okay, great. Alright, I'm going to go ahead and let the table dry for 2 minutes. I'm going to do hand hygiene for 20 seconds, and I'm going to put on a pair of new and clean gloves. Alright, Mrs. Cap, I'm going to put you down in a supine position. Do you mind if I pull down your blanket? You don't? Okay, thank you. I'm also going to have to lift up your gown just to access the genital area, okay? But first I'm going to put you in a foggy position, making sure it's external, and I'm going to support your knees and ankles while I do this. And I see that you already have a chunk, but I'm just going to go ahead and add an extra towel just to keep the area clean, okay? Do you mind if I lift up your gown? You don't? Thank you. Alright, I'm going to do hand hygiene for 20 seconds. I'm going to put on a pair of new and clean gloves. Are you ready for the initial clean, Mrs. Cat? You are? Okay, great. Alright, I'm going to put this away. I'm going to do hand hygiene for 20 seconds. And I'll put on a pair of new clean gloves. We doing okay, Mrs. Cat? Yeah? Okay, great. Alright, Mrs. Cap, I'm going to go ahead and put this drape right below you, just to keep the area clean while we work, okay? Do you mind if I lift up your gown? You don't? Thank you. Alright. I'm going to do 20 seconds of hand hygiene and put on a pair of new and clean gloves. Alright, Mrs. Cat, I'm going to do 20 seconds of hand hygiene. Looks like we're ready for the clean. Are you ready, Mrs. Cat, for the second clean? Yes? Okay. Alright, and now I'm going to go ahead and insert the catheter. So I'm going to have you take a deep breath. On the count of 3, I'm going to have you blow out, okay? So take a deep breath, and then 1, 2, 3, go ahead and blow out. Alright, I'm seeing some urine return, so I'm going to go ahead and advance the catheter 1 to 2 inches. Alright. I'm going to go ahead and inflate the balloon now. Do you feel any pain when I do this? No? Okay, that's perfect. I'm going to test for resistance. Resistance has been met. Alright. I'm going to go ahead and scrub the hub with the CHG wipe for 5 seconds. Alright, and then I'm going to go ahead and let that dry for 5 seconds. And I'm just collecting the urine sample right now, okay? I'm going to collect 10 milliliters of urine. Alright, Mrs. Cap. I'm going to go ahead and just wipe the skin with a prep pad, and this is just to make the skin a little tacky for the stat log, okay? I'm going to take this. Okay, and then I'm going to go ahead and hang this on the side of the bed, making sure it's below the bladder. Okay. All right, does everything feel okay? Yeah? Okay, great. I'll go ahead and pull this out. I'm going to do hand hygiene for 20 seconds. All right, Mrs. Cab, do you feel any pain? No? Okay, great. Do you feel like you tolerated that procedure well? Yes? Okay, amazing. And I'll go ahead and just put your gown down as well. All right, so then I'm just going to go ahead and deal with the urine sample right now, okay? I'm going to do hand hygiene for 20 seconds and put on a pair of new and clean gloves. I'm going to go ahead and put the patient's name, MRI number, and a date and time of collection, and I'm going to send this to the lab. All right, Mrs. Cap, only 20 seconds of hand hygiene. Looks like we're all done. You need anything else from me? No? Okay, great. I'll go ahead and put your side rails up. I'm going to give you a call out bell in case you do need me, and I'm going to put your bed in lowest position. All right, thank you, Mrs. Cap. I'm going to go ahead and document the date and time of this procedure. I'm also going to mention how the patient tolerated it well with no reported pain. I'm also going to mention the size of the catheter, which is a size 6. And I'm also going to mention the urine output of 150 milliliters and how the urine was clear, yellow, and had no sediment. Thank you.